We see our 911 system activated for people in crisis, and we see more and more calls for mental health, for substance use disorder, and social issues like housing needs. We respond on the weekend, at night, if you're housed, if you're under a highway overpass, we send someone to help you. Our 911 system is a safety net. When other systems of care fail or are closed, paramedics respond. Look at me. My mom sent this to me this year. That's me, before I even knew I would be in the fire department. We are professional helpers. Give us the tools we need. We're mission-based. We want to help. We want to get the job done. We need to invest in the training of our paramedics, EMTs, and first responders so that they can better serve and understand this growing population. Here in California, community paramedicine is a regulated practice, and San Francisco Fire Department has the first community paramedicine training program and the first community paramedicine program in the state. Here's my blue card, my paramedic card, but here is my community paramedic card. So this is my local community paramedic accreditation. It's here in San Francisco, and I'm very proud of that. Community paramedics are handling over 10% of total 911 system call volume, and we're directing a large majority of that call volume away from emergency departments and towards more appropriate systems of care.
The shootings, stabbings, they do take a lot of energy.
But talking down somebody who's in a meth-induced psychosis, you can do that 1,000,000 times, and the next time might not be like any of the other 1,000,000 times you've run it before. And you have to be on your toes to pay attention to what they're saying, not trigger them. You run out of energy on those calls very, very quickly.
Moral injury is a new word, but not a new idea. And it's the harm that comes to first responders from not being able to help. One way that we've found a good resiliency effort we can do to support our own crews is peer support conversations, potentially led by a clinical peer who can ask them, hey, what went right this week? What went wrong this week? What was hard this week? Tell me about some of your rough calls. That call is bread and butter call for any paramedic. It's a man down call. There's someone on a blanket. We're worried about them. We have to check on them. And then you find out there's a big story to their whole life, to everything leading up to this moment, that we were able to have an on view with a 911 system unit that ended in a shelter bed placement probably 20 minutes later and drive that person directly there. That's the incredible wins and the incredible opportunities that we're seeing here in San Francisco, and that I'm hoping spread to other 911 systems around the state. I see community paramedicine and community paramedics as pioneers in EMS, in leading our communities and our nation into the next evolution of 911 and the next evolution of paramedicine. If I were to share a dream state of what our 911 system would look like in 20 years, it would be that every paramedic is a community paramedic, and that we invest more in our first responders, that we have a connected, not fragmented system of care. What's driven me in between those wins are the very, very tiny moments where I think to myself, I can move the needle for this person a little bit today. You're having a tough day. I see you as a human. I know you. I already know a little bit about you, and I'm here to help.